Hey Alpha Nurses, I'm Nurse Sandra from alphanursguide.com. This is NCLEX PN Review Lesson 27. We're going to be doing pediatric nursing questions. You can follow me on Facebook, Instagram, and TikTok to get any updates. All links are in the description. Without the way, let's get started.
Question 1. After a tonsillectomy, the child begins to vomit bright red blood. Which is the initial nursing action? A. Turn the child to the side. B. Notify the healthcare provider. C. Administer the prescribed antiemetic. D. Maintain nothing by mouth status. The correct answer is A. Turn the child to the side. Rationale: after a tonsillectomy, if bleeding occurs, the child is turned to the side, and then the HCP is notified. An NPO status would be maintained, and an antiemetic may be prescribed. However, the initial nursing action would be to turn the child to the side. Question 2. The nurse reinforces instructions to the mother of a child with croup about the measures to take if an acute spasmodic episode occurs. Which statement by the mother indicates the need for further teaching? A. I will place a steam vaporizer in my child's room. B. I will take my child out into the humid night air. C. I will place a cool mist humidifier in my child's room. D. I will place my child in a closed bathroom and allow my child to inhale steam from the running water. The correct answer is A. I will place a steam vaporizer in my child's room. Rationale: steam from warm running water in a closed bathroom and cool mist from a bedside humidifier are effective for reducing mucosal edema. Cool mist humidifiers are recommended as compared with steam vaporizers, which present a danger of scalding burns. Taking the child out into the humid night air may also relieve mucosal swelling. Remember, however, that a cold mist may precipitate bronchospasm. Question 3. The nurse reinforces instructions to the mother of a child who has been hospitalized with croup. Which statement made by the mother would indicate the need for further teaching? A. I will give my child cough syrup if a cough develops. B. During an attack, I will take my child to a cool location. C. I can give acetaminophen if my child develops a fever. D. I will be sure that my child drinks at least 3 to 4 glasses of fluids every day. The correct answer is A. I will give my child cough syrup if a cough develops. Rationale: cough syrups and cold medicines are not to be given because they may dry and thicken secretions. During a croup attack, the child can be taken to a cool basement or garage. Acetaminophen is used if a fever develops. Adequate hydration of 500 to 1,000 milliliters of fluids daily is important for thinning secretions. Question 4. The nurse is working in the emergency department and is caring for a child who has been diagnosed with epiglottitis, which is an indication that the child may be experiencing airway obstruction. A. Nasal flaring and bradycardia. B. A low-grade fever and complaints of a sore throat. C. The child thrusts the chin forward and opens the mouth. D. The child leans backward, supporting himself or herself with the hands and arms. The correct answer is C. The child thrusts the chin forward and opens the mouth. Rationale: clinical manifestations that are suggestive of airway obstruction include tripod positioning, nasal flaring, tachycardia, a high fever, and a sore throat. Question 5. After a tonsillectomy, which fluid or food item would be appropriate to offer to the child? A. Yellow Jell-O. B. Cold ginger ale. C. Vanilla pudding. D. Cherry popsicle. The correct answer is A. Yellow Jell-O. Rationale: after a tonsillectomy, clear, cool liquids should be administered. Citrus, carbonated, and extremely hot or cold liquids need to be avoided because they may irritate the throat. Milk and milk products are avoided because they coat the throat and cause the child to clear the throat, thus increasing the risk of bleeding. Red liquids need to be avoided because they give the appearance of blood if the child vomits. Question 6. The nurse is preparing for the admission of an infant with a diagnosis of bronchiolitis caused by the respiratory syncytial virus. Which interventions should be included in the plan of care? Select all that apply. A. Place the infant in a private room. B. Place the infant in a room near the nurse's station. C. Ensure that the infant's head is in a flexed position. D. Wear a mask at all times when in contact with the infant. F. Place the child in a tent that delivers warm, humidified air. E. Position the infant side lying, with the head lower than the chest. The correct answers are A. Place the infant in a private room, and B. Place the infant in a room near the nurse's station. Rationale: the infant with RSV should be isolated in a private room, or in a room with another child with RSV. The infant should be placed in a room near the nurse's station for close observation. The infant should be positioned with the head and chest at a 30 to 40 degree angle, and the neck slightly extended to maintain an open airway, and to decrease pressure on the diaphragm. Cool, humidified oxygen is delivered to relieve dyspnea, hypoxemia, and insensible water loss from tachypnea. Contact precautions reduce the nosocomial transmission of RSV. Question 7. The nurse is caring for a hospitalized infant with bronchiolitis. Diagnostic tests have confirmed respiratory syncytial virus. On the basis of this finding, which should be the appropriate nursing action? A. Initiate strict enteric precautions. B. Wear a mask when caring for the child. C. Plan to move the infant to a room with another child with RSV. D. Leave the infant in the present room because RSV is not contagious. The correct answer is C. Plan to move the infant to a room with another child with RSV. Rationale: RSV is a highly communicable disorder, but it is not transmitted via the airborne route. It is usually transferred by the hands, and meticulous hand washing is necessary to decrease the spread of organisms. The infant with RSV is isolated in a single room, or placed in a room with another child with RSV. Enteric precautions are not necessary, however, the nurse should wear a gown when the soiling of clothing may occur. Question 8. The nurse is instructing the mother of a child with cystic fibrosis about the appropriate dietary measures. Which meal best illustrates the most appropriate diet for a client with cystic fibrosis? A. Veggie salad and a caramel apple. B. Strawberry jelly sandwich and pretzels. C. Plate of nachos and cheese and a cupcake. D. Chicken tenders and a baked potato with butter. The correct answer is D. Chicken tenders and a baked potato with butter. Rationale: children with CF are managed with a high-calorie, high-protein diet. Pancreatic enzyme replacement therapy is undertaken, and fat-soluble vitamin supplements are administered. Fats are not restricted unless steatorrhea cannot be controlled by increased levels of pancreatic enzymes. Chicken tenders and a baked potato with butter provide a high-calorie and high-protein meal that includes fat. Question 9. The nurse reviews the results of a tuberculin skin test performed on a 3-year-old child. The results indicate an area of induration that measures 10 millimeters. How should the nurse interpret this result? A. Positive. B. Negative. C. Inconclusive. D. Definitive, requiring a repeat test. The correct answer is A. Positive. Rationale: an induration that measures 10 millimeters or more is considered to be a positive result for children who are younger than 4 years old, and for those with chronic illness, or with a high risk for environmental exposure to tuberculosis. A reaction of 5 millimeters or more is considered to be a positive result for those in the highest risk groups. Question 10. The nurse should place the child who had a tonsillectomy in which position? A. Supine position. B. Side lying position. C. High Fowler's position. D. Trendelenburg's position. The correct answer is B. Side-lying position. Rationale: the child should be placed in a semi-prone, or side-lying position, after tonsillectomy to facilitate drainage. Options A, C, and D will not achieve this goal.
That's all I have for this video. Please like, share, let me know if you have any questions. If not, I'll see you in the next video. Thanks for watching.